this episode of Africa Health Check.
The pandemic has affected me through having fear. You have fear all the time that if somebody coughs, maybe it's the COVID-19.
If I were somebody who believed in Western medicine, it would have affected my mental health.
We analyze the post-pandemic mental health situation in Africa.
Mental health starts at home because mental health is three things. Number one is how I think, then how I feel, then how I act to people.
And discuss ways in which we can all aid in breaking the stigma associated with mental health. Evidence and published literature related to previous epidemics suggests that mental health issues tend to rise after the peak of a pandemic, with increased prevalence among the vulnerable populations. On today's episode, we will be discussing post-pandemic mental health and breaking the stigma. I'm your host, and I welcome you to Africa Health Check. I'm joined by our experts, Dr. Marianne Morathi, the chair in the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi in Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we hear from them, let us have a look at this episode's feature story.
Our company is dealing with a training corporate on the issue of well-being for peak performances. For example, issue of stress management, emotional control, team building and retreats. Currently, the situation in Africa is increasing level of stress. Stress level is going up and up day by day. One of them is post-pandemic stress disorder. We can see it just after COVID-19. Why? Because people are facing a lot of fear on the issue of gathering. You know why? Because they are afraid of coming in contact again with the diseases such as COVID-19. People are becoming unsocial day by day. They are afraid of people. They opt to stay alone for a long time. And also the issue of memory on the memory from their lost ones. Suppose my parent is died due to COVID-19, my partner has died for the COVID-19, so people has a lot of fears on that side of issues of COVID-19. And also radical parenting in Africa. Parents are not responsible for their children. They're just parenting their kids, not thriving for their betterment of their future. And also the issue of economy level, issue of poverty level. So stress level in Africa is still higher day by day. The best approach to use to educate this world, especially Africa continent, is to produce special movies that raising awareness about mental health. And this movie has been broadcasted all over Africa. Why? Because we see the real life stories of people that have been fighting their own battles. They have been going through a lot, had challenges. So if we see their movies, even if recorded one, but it can deliver certain kind of messages to people. You know why? Because movies just some part of entertaining and the other part is educating. So that's number one. Number two is introduction of Stay Fit Marathon, our campaigns, our programs. Each country, everywhere, we are supposed to initiate this program, Stay Fit Marathon campaigns, where we can have a special message concerning maybe how to stay with the stress, how to deal with the stress. Major stigma that we are facing here in Tanzania. Number one, I think that issue of labeling people. Yeah? We are making them to become reluctant to express themselves and to be open to medication or treatment. Number two is issue of disvaluing them as if they can't share any opinion. You don't validate their opinions. I know you have mental health problem. When it's cheesy, how can you share this idea in front of us? And the last one is offending people with mental health challenges. We offend them, we attack them, we judge them. Number one thing supposed to be done is establishment of mental health support desk. in each organization, whether it is in school or in companies. Why? Because having this mental health support desk is a place where you can share our views, we can share our opinions. Number two is regular retreats programs. You know, if these workers have some time together going outside for refreshment, there's where they can share a lot of things. You know, what I believe is going outside for excursion programs like that, you treat yourself, you heal yourself. There's a lot of benefit from the sun rays to our mental health. For teenagers, number one thing is to be provided with skills on self-management, self-awareness. This is a very important one. They're supposed to have knowledge on how to control their emotion, how to respond if they feel something. Each parent, you are supposed to listen to your kid with all heart, with all here, you know. Why? Because sometimes we are judging them, we don't understand what they say to us, so how they speak to us. Yes, you know, so parents, daddy or mommy, they're supposed to be attentive and very good and listening to their kids, because that's the only place they can share their feelings. They can share how they feel, or what happened on the streets, yeah, during their absence, you know. So this is the only way they can do. And the third thing is, make sure the parent, daddy or mom, make sure you are available to them. Sometimes we are too busy with our work and we forget our kids. Parenthood issue now is being challenging. Sometimes we become harsh from the office to our home places, so we bring office matters to the home. So destroying a relationship between parents. Mental health starts at home, because mental health is three things. Number one is how I think, then how I feel, then how I act to people. So if there is no love inside my mind, then I won't feel it and I won't act to people. So I become an aggressive person. My advice to the world, to people, to viewers of this is they have to be free to open up when they feel something that's not good, not okay. You don't feel ashamed to express your feelings, because we're all going through the same mapito. You're going through challenges a lot, and make sure you trust someone to talk to. If there is a person near to your places or to someone elderly at your home place, share your story, share your feelings, share something you have with them. Maybe they can give you something.
Very important ending there to say we should feel free to find somebody that we can trust, that we can talk to, we can reach out to, because many a times we actually are all facing the same problems, and talking to people can help. So let me invite Dr. Marianne and Reverend to jump in on this topic, post-pandemic mental health. Dr. Marianne, usher us into here. What exactly are we talking to when we're talking about post-pandemic mental health?
Yes, a very important topic, and something that's quite intriguing. And what is post-pandemic mental health is, again, what did we emotionally and spiritually, we can state that, go through post the pandemic. COVID came, there were so many uncertainties, so many deaths, so many people lost their loved ones. Healthcare providers were facing death every day and facing the unknown, the fears, the unexpected outcomes as well, was one of those things that was contributing to one to feel very uncertain of the future, and that contributed to that instability in your emotions, just not being in control of a situation, and that really fired up what we're calling mental health, where you're not feeling yourself, you're low in mood, things that used to excite you don't excite you anymore, you're tired more than usual, you are not engaging as you should be, and you're generally quite low. And maybe if you're in a family setup, you're not really interacting with your loved ones, your behaviors have changed, you're not yourself. And again, the funny thing is, in our setup, we don't have a name for that. Either you be told, if you're a man up. We want you to
snap out of it.
Come on. If you're in a religious perspective, and the Reverend would tell us, people will pray for you, and you'll be called for spiritual retreats. Right now, I have a case where I can clearly tell it's a mental health issue, and if we just find the correct balance of medication and counseling, this young man will be okay. But the mother's like, no, I am taking him to the mountains. There's this healer who is going to pray. It's a demon. I'm going to pray and this demon will go away. And I really had to now sit down with the mother and, of course, talk to her about the love of God, and God loves us and God wants the best out of us.
Yeah.
But also there's a solution to your son's distress and your son's behavior. Can we start off with a mental health expert, maybe to see why is this young man was carrying around a big knife and running around his town, the township, threatening everyone, I'm going to kill you, I'm going to kill you. He's hearing voices in his mind. And of course, if you're not well trained, you'd think, yes, indeed, he's possessed. And having to console the mother, again, was really a good thing. And because the young man was then taken to a mental health hospital, saw a doctor, saw a counselor, they were able to actually identify the problem.
Absolutely. And I'm happy you're talking about the initiatives, and you could share some of them later on in the show. I want to invite Reverend into this conversation. Dr. Mary Ann mentioned a lot about the spiritual aspect that is associated with mental health. And I think a big concern is how sometimes mental health is really demonized in our African society, and that drives the stigma. Is this because of lack of knowledge, or is it because we don't understand, or we just refuse to comprehend how mental health works? What drives this demonizing and stigmatizing mental health?
I think you hit the nail on the head. We oversimplify people's problems. She was talking about, Dr. Miriam was talking about a child having problems and the mother rushing the child to the mountains to be prayed for. You see, the lack of knowledge here is that mental health is not all spiritual. Probably, if they had taken time to investigate, to ask the child, to ask the background of the child, maybe a childhood traumatic experiences. You know, she was sexually abused, the father died, something happened and has not found any healing, and has been a buildup. Why do you rush this child to the mountains? The prayer doesn't necessarily dissolve all this. There is a biological, effects. Is born with certain health challenges that must be known. So my issue is diagnosis. My issue is, how do we reach that conclusion that this person's situation is demonic, is spiritual? That is not what we do most of the time. And unfortunately, at the faith-based organizations, Christian churches and other religions, default in the same way. But now I think people are warming up to the challenge that, no, let us pause, let us be careful, let us show empathy, let us love the person. After all, that is what God is all about. And if we showed some little patience to investigate the cause. She was talking about post-pandemic, somebody lost their jobs, a breadwinner with a wife and 3 children, some of them are in colleges. He has not been able to get a job back. Meanwhile, he's fully responsible. How does this person sleep? It's economic. The mother and the father died in the COVID. I read stories during the COVID time. Father and mother just passed away, a single child. And just from nowhere, this incident happens to the person. And then you meet the child so moody, not talking, crying all the time. You say, no, it's demonic. So I think that there must be real education. Those mental health experts, practitioners need to come up with something. I like the feature when he said that there must be mental health posts at strategic places with people that are trained, or like stop points. Like if you have these feelings, these kind of, talk to somebody, and here is the identified person to talk to.
Absolutely. And maybe since you're coming from the religious community, we could just use this as an opportunity
Yes.
to maybe send out a message on what role the religious community, regardless of denomination, can play in destigmatizing mental health post COVID-19.
One, if they themselves, if the religious leaders understand this progression, understand the root cause of mental illness. You see, the society, African indigenous society, and our belief systems, we have so much faith in the religious leaders.
Yes.
That if the religious leader accepts you, then other people will accept you.
Of course.
If the religious leader visits you and relates to you in a loving, caring, acceptable ways, the community
will do the same.
Because the sad story is when a family decides that our son, our niece, is demonic, so we ourselves don't want the child. We don't want him. He's suffering. He's paying for some punishment. That is why he's behaving that way. Then it's very, very sad. But the truth of the matter is that when opinion leaders and community leaders, religious leaders embrace these people with love and care and attention and patience and minister this to them, then there is everything, because the ordinary person suspects that the person is demonized. Meanwhile, I saw my pastor share food with the same person.
Yes.
Then what might be going on? And because the religious leader or the faith-based leader has power, has influence on these people. So I would say that most of these beliefs, our indigenous beliefs about who are mental how to call it, people suffering from mental, if they take the steps in our setting, not overseas, in our setting, a lot could be achieved.
A lot.
On the communicable diseases awareness, I think there's little awareness to the issue, and I think we need to put more resources to the issue and sort the problem.
The youth are actually vibing hard. The youth are actually working hard to make sure they are part of the system. But their cry, their plight are not being heard by the people in charge.
I want to furthermore go on advise those people who are not able to go for vaccinating. They still have a chance. They can go and vaccinate them so that we can live in a healthy country with a healthy life.
Now, I want Dr. Marianne to weigh in here. What are the long-term effects of COVID-19 on mental health generally, and why is it that we see a rise or an increase in mental health issues post-pandemic?
Well, there are two ways to look at this. The rise of mental health issues post-pandemic. One of them, yes, we went through trauma. The whole world went through trauma. Let's not deny it. Let's not just say, let's snap out of it and continue. No, we need to identify it, call it by name, and then now rebuild ourselves. But on the other hand, there are also so many avenues to now talk about how we are feeling. I've talked about some initiatives that we came up with. There are others you'd find on social media. There are others you'd find in the church spaces. People are able to realize, I'm actually not very well. And that way, they were able to now seek some medical interventions. So there are more people seeking help. Because again, we're now talking about what we are feeling. It's not normal. It's named, it's a mental health issue. You're either clinically depressed, or you're going through some depression, or you're low in moods. So again, people are reporting it more. So it's been documented more. And that's why you're seeing also a high number of mental health issues now being reported, because we have spaces, safe spaces to talk about them.
Yeah, absolutely. And I think one of the things that also has been been quite visible is that we've been seeing a lot of children, experiencing a lot of mental health issues. Some of them are vocal, some of them are not vocal. I know in my country, a lot of us have been shocked at how we're seeing 10-year-olds attempting suicide or, even committing suicide, So maybe, Reverend, we could just speak to that as family members, parents. How do we create a healthy environment for children to be able to express themselves, especially, in an African context, where we tend to, I know there's this social media joke, I don't know if you're aware of it, where they say, act like an African parent.
Yes.
And then they'll say, an African parent will say, why are you sad? I bought new shoes for you. Or why are you depressed? I paid your school fees, we say it as a joke, but it's the reality of how we don't have enough safe spaces to actually allow our children to express themselves or communicate their feelings or even express themselves freely. So how can we as family members, as parents, siblings, aunts and uncles, create that environment?
Well, it's an environment of love, of acceptance, and of care. The father being there always for the family, for the children. But the story, most of the time, to be different. It's one woman, a mother, saddled with 3, 4, 5 children, trying to fend for them, and it's difficult. One would have thought that in a kinship family where, we born together, other people will understand the plight, but they are in no better position really to help. So it leads me to add that let us depend on our mental health experts, those who have been trained in psychology, psychiatry. Give them the opportunity, the support, build the facilities, the institutions, and then refer the 10-year-olds to them so they can engage them in a systematic, progressive way to know what the problem is.
Yes. Thank you very much for that. And Dr. Mary Ann, as you give your parting shot, I know you're really well traveled and you tend to partner with other medical institutions and you've benchmarked a lot. Maybe you could share some of the best practices in terms of institutions, systems, mechanisms that you've seen in other parts of the world in terms of addressing mental health issues for all age ranges that have worked effectively that perhaps we could also apply in our countries in Africa.
Yeah, so maybe starting from home and starting from where I'm based at work, we now, post-COVID, we have something we call the Wellness Forum. We meet every week, and we're not going to talk about vaccines or a new disease coming up, but it's just talking about, how are you? Yeah, are you okay? And then in those forums we invite various speakers, people to talk about our nutrition. Are you eating okay? Are you exercising okay? Yeah. Are you managing your finances okay? How is your emotional intelligence? Last week we had a speaker coming to talk to us about career development. And it's such a breath of fresh air because you're bombarded with, just disease diagnosis and patients numbers. So it's made us more happier, if I can say that in a small voice.
And you connect much more.
We connect more and oh, you're going through that as a doctor, as a nurse, as a medic. Oh, fantastic. So, I'm not alone. And we have a forum where we can, a very safe space to talk about it. And that has really transformed even the way we work because we are happier. So again, it's just, let's talk about these things. Let's talk about how we are feeling. Well, let's normalize talking. Me asking you, Gigi, how are you? I know the answer will be fine.
Yeah,
but really,
it's just okay.
Can we say, actually, today I'm not okay? Yeah. Someone once told me that I'm not okay, and I didn't know how to react. Like, oh, I was expecting you to say you're fine.
Yeah, that's also the thing. I mean, sometimes maybe we're also not opening up because, you don't know what to expect on the other end. If I say, Dr. Mary, I'm not okay, what next?
I guess it depends on the relationship. Communication is at various levels. If I can trust you, and if you can do something about the problem that I have, and if you will not use my problem against me or spread it around, then I will open up.
You
understand? So it's that kind of, I believe, relationship that we need to
building relationships.
Yes.
That's what we say.
that was the right thing.
No, that's true. And maybe just your final parting shot, Reverend, just a tip that you can give to people on how to cope post-COVID-19. Just it could be a simple lifestyle change at a personal level, but just could be something that you do or that has helped you with coping post-COVID-19.
I would say that, first of all of us, including people with mental health problems, need to understand that there are problems in life. That is the beginning point. Otherwise, you isolate yourself and think that you are the only person going through a financial crisis. You are the only one who has been abused, who has lost your parents. It's not so. So many people are going through the same thing. And when you understand, when you know that, look for someone you can trust to confide in, to share your fears, your pain, your sorrow. Even if they can't help you come out, just the talking out of it is therapeutic.
It's therapeutic, it's healing on its own.
And allow the person to do referrals. Yes, I cannot help you in this category, but I know Dr. Marian. She's a trusted friend. She has helped other people. She'll be able to help you. Would you like me for me to take you to her? And it works that way, rather than sitting all by yourself, and then people begin to think that maybe a demon has pounced on you, and that is the thing. So I think that, and then those of us who are not in that category, we need to be empathetic. We need to show that we care.
Exactly.
All of us need to be encouraged.
And we're normalizing things that usually make us, be afraid to interact with people. But, once you normalize failure, once you normalize, having to start all over again, then there's no shame, No, I think that's really profound. There's this saying that I absolutely love that says, everyone you meet is fighting a battle you know nothing about. Always be kind. And I think that is the perfect way to wrap up. And I think that is the perfect way to wrap up this episode. Make sure that you spread love and kindness. Before we wrap up the show today, I want to take a look at our African Health Champion for this episode.
For our Africa Health Champion on today's show, we meet Dr. Georges Bwele from Cameroon. Through his non-profit Ascovim, he pioneers medical and surgical clinics that redefine access to care for hundreds of thousands. The organization's unwavering focus on the most vulnerable, like those in nursing homes, orphanages, and refugee camps, resonates with the ethos of women health champions advocating for marginalized communities. Dr. Bwele's journey transcends the pandemic. His dedication predates it. He embodies the spirit of resilience, delivering vital medical resources to those who need them most, bridging gaps for those without means.
And that brings us to the end of today's episode. From my awesome Africa Health Check team and I, we give you a big thank you for tuning in. Remember to subscribe, like, share, and leave a comment on all our digital platforms so that you may form part of the stories we highlight right here. Make sure you follow us on Facebook, Twitter, LinkedIn, YouTube, as well as Instagram. The handle is at Africa Health Check. Until we meet again, same time, same place, same date, remember that the future is Africa, the future is today.